not be familiar with the CTRJJ. Our Cat 2 Center is the only Category 2 center within the network that is 100% focused on the youth justice system. And the mission of the CTRJJ is to support a comprehensive framework for developing, adopting, and implementing and sustaining evidence-based trauma-informed services for youth who are in or at risk for involvement in the juvenile justice system, also their families. And also, we have initial initiatives that are part of our work plan of actually supporting staff that are working within the system as well. And at the end of the presentation, there will be a QR code that will allow you to sort of link up to a number of our resources that we are offered through the CTRJJ. But I'd like to jump into and kind of talk with you a little bit about the agenda, what I'd like to try to accomplish today. I'm assuming that a lot of people on the call are not going to be familiar with the most predominant model of case planning in the juvenile justice system, which is known as the Risk-Need-Responsivity model. I'm going to provide a brief overview of that model and highlight how it really informs violence risk reduction efforts within the youth justice system. Then I'm going to turn and discuss how trauma-informed care principles both complement and can enhance the R&R model for a more holistic understanding of what I would refer to as kind of like the drivers of youth violence, and then creating opportunities for us to think about ways of intervening to promote recovery and resilience. And then from this as well, I'm going to take a little risk with you all today and identify what I've sort of gleaned and did for this talk as some lessons learned, and really from the perspective of adolescents and their trauma histories, and utilize this to sort of frame up some lessons learned of highlighting some what I believe are some important practice gaps and some opportunities for enhanced service planning and what I would refer to as a more holistic support for violence prevention and intervention efforts, particularly for adolescents in the youth justice space. Now, I've mentioned a number of things here, but and I didn't do much of an introduction here because I don't like to rest on titles and all that fun stuff, right? But I do think it's important for me to acknowledge a few things that will help frame up this presentation. I'd like to acknowledge that I really approach this work from the perspective of a juvenile forensic psychologist with over 25 years of professional experience working within the youth justice system spaces. And like many of us, right, I wear many hats: faculty member, researcher, consultant, trainer, focusing on youth justice system reforms, hopefully balancing, effective and responsive services for youth and families with that balanced perspective of protecting public safety. But I'm also really going to be drawing on my practitioner hat with you all today to form up some of those lessons learned. Now, I would also want to acknowledge is that for over 15 years, I've been working towards effective infusion of trauma-informed or trauma-responsive services within youth justice spaces. But as a practitioner, and increasingly over the past 10 years, most of the independent forensic evaluation work that I do involves conducting evaluations of adolescents and transition age youth, often charged with homicides. With these evaluations, often involving gun violence and often involving adolescents who were victims of that gun violence, where the trauma histories have been of relevant consideration in the judicial decision-making process. So with those acknowledgments, and before I sort of jump into the R&R model, I think it really might be helpful for us to think about youth justice spaces and how it's been really transformed. And so for those of you who don't live and breathe this work like I do, I want to acknowledge that we have 16 years now of United States Supreme Court holdings, starting with a case in 2005 of Roper v. Simmons, and a more recent case in Jones v. Mississippi in 2021, that have created a legal framework to recognize that adolescents are different from adults. And the term that is often used in this jurisprudence is that adolescents are categorically less culpable than adults. And this began in 2005 when the Supreme Court reinforcing this legal distinction and when it prohibited the application of the death penalty to juveniles. And in that case, Justice Kennedy drew on three important adolescent distinctions. So the lack of maturity and what he called an underdeveloped sense of responsibility. And this leads to, I kind of love this quote, he was very flowery with his language, to impetuous and ill-considered actions and decisions. Right? And he went on further to say that juveniles are more vulnerable or susceptible to negative influences and outside pressures, particularly peer pressures, that the character of a juvenile is not as well formed as an adult, and that the personality traits are more transient and less fixed. And this drew heavily on our knowledge around adolescent brain development and behavioral science data, recognizing that, and this is that distinction, that adolescents are categorically less culpable than adults, particularly for purposes of receiving punitive sanctions when they often engage in violent behavior. And the court has done nothing but reinforce this distinction of adolescents being categorically less culpable than adults, with a 2012 case, really pinning this down even further, and with Justice Kagan writing for the court saying it's increasingly clear that adolescent brains are not yet fully mature in regions and systems related to higher order executive functions such as impulse control, planning ahead, and risk avoidance. And for those of you who work with adolescents day in and day out, like I do, some of this will really make sense, right? But drawing across these Supreme Court cases, prominent forensic psychologists have really distilled that courts have recognized that there are 5 legally relevant features of adolescence. The first is decisional. Adolescents are more prone to engage in sensation seeking and risk taking and poor judgment. We also recognize there's a dependency characteristic, that the family and home environment and peer influences of adolescents across their early development through their adolescence is particularly important. And then, and that it's really important to take those decisional and dependency characteristics into account when we think about the offense behaviors, often including the violent behaviors that adolescents can get charged with as well. Importantly, though, the court has recognized the rehabilitation potential. And in adolescents, if they're categorically less culpable, one of the factors here is that adolescents are viewed as showing a greater propensity for the possibility of change. So a greater opportunity for rehabilitation potential as well. Now, all of this is great, and I think it just provides a framework for thinking around the idea of adolescence as being in development, right? Another way of thinking about this is that the brains of adolescents are under construction. But I think we all know that maturity and immaturity are really relative. It's really informed by our understanding of adolescence as a class as a whole. But yet, when we start thinking about service planning and understanding the behaviors that an individual adolescent has engaged in, that's going to take a more individualized approach. But for those of you who are, like I said, don't live and breathe youth justice in the way that I do, we are currently in what is oftentimes referred to as the 4th wave of juvenile justice reform that is really anchored on these Supreme Court precedents of really shaping and changing the way that we think about adolescents and their responsibility or their culpability, if you will, and appropriate sentencing options when they engage in violent behaviors. The National Conference of State Legislatures did a really nice brief summary of what we know about brain development and justice system involvement. What we know is that brain development continues to mature, and it doesn't stop at 18. It actually, continues to mature into the mid to late 20s. That adolescents have challenges relative to adults in the ability to engage in appropriate executive functioning or self-control. That adolescents and young adults need guidance and support to consider long-term consequences and make future-oriented decisions. And as I mentioned before, that young people because their brains are still developing and they are still maturing, that this gives us opportunities of responses for interventions and incentive-based interventions as well. And I think that there's a greater recognition in this fourth wave of juvenile justice reform, that recognition that adolescents tend to, as a group, outgrow their delinquent behaviors, including violent behaviors as well. And that only a small proportion of adolescents, some research longitudinal studies suggest that's maybe 10% to 15% are going to sustain and continue to engage in violent behavior into adulthood. So all that being said, we've made positive movement, right, around this within the youth justice space. But I just want to fully acknowledge too is that these reforms are fragile. And I'm going to highlight some information from New York reforms and New York reforms in particular to kind of show you some of the fragility here, drawing on some local headlines. And so let me place this in a little bit more context. The state of New York passed what is known as Raise the Age legislation in 2017. And this eliminated in New York automatically charging 16 and 17-year-olds as adults. Okay. Basically automatically charging, regardless of if it was a misdemeanor or a felony. Prior to 2017, if you were 16 or 17 years old, arrested and charged, your case would be heard in adult court. So this law, Raise the Age, effectively eliminated that practice and moved the vast majority of cases of adolescents, 16 and 17 years old, particularly misdemeanor cases, and it kept them in New York in what's known as the family court system, in other words, the juvenile court system. However, there are exceptions. Youth between the ages of 13 and 17 who are accused of serious crimes, and these are often involving violent crimes, with gun violence, attempted murder, and murder, can still have their cases retained in adult court with what is known as the youth part. And the Raise the Age legislation in the past few years has come under a lot of fire. So here's a headline from a news story published in April of 2023. And this report noted that major felony crimes in New York City had actually decreased, but in the first quarter of 2023, there was concerns about the increasing number of arrests of adolescents who were being charged with violent offenses. There was a quote from the former New York Police Department commissioner, and that said, a significant number of our shootings involve our people who are young and center on gangs and street crews. And then the story went on to highlight and show a still video of a 16-year-old male in Brooklyn implicated in the fatal broad daylight shooting of another teen. Here's another New York Post story published in May of 2023. It acknowledged that violent crime arrests are skyrocketing in New York City for kids in 2023. And a now retired, at that point, police official blamed the staggering increase on the Raise the Age law, saying things like, these kids have no repercussions. They get arrested and released, arrested and released. We're prosecuting 16 and 17-year-olds with kid gloves. An opinion piece emerged also around the same time in 2023, drawing on crime statistics in the city and saying that in 2022, 1 in 10 shooting victims were actually under the age of 18. This commentator was also blaming the Raise the Age legislation, saying that New York's most vulnerable will continue to be terrorized by an unworkable, opaque system that rewards the bad behavior of teenagers who will never, ever learn any better. Okay. And these sorts of commentary were in popular press in New York City. And you can sort of see that the tone of this is definitely away from that idea of adolescents as being categorically less culpable than adults. And does Raise the Age lead to more juvenile violent crime? Now, I won't spend a lot of time unpacking this, but this was a study that was done by the Criminal Justice Research and Evaluation Center at John Jay College of Criminal Justice. And basically, what the researchers concluded is that despite this sort of rhetoric that was happening, that this study essentially showed that there was not enough data or evidence to prove that raise the age legislation has led to a rise in juvenile violent crime. Um, um, but and I'll sort of conclude with this final segment here as well, is that as recently as in this past legislative session, there's been efforts and efforts to move away to scrutinize and change raise the age. Both supporters and opponents are essentially not happy with how it's been implemented. First of all, the money that was allocated by the legislature, which since 2018 was over $1.5 billion, that was supposed to go to local counties and jurisdictions to support prevention and early intervention programs. Only half of that money has been spent. And instead of supporting early prevention and intervention programs, it is more likely gone to reimburse jurisdictions for placing adolescents in long-term secure custody facilities as well. And while it didn't catch any traction and it didn't pass, a bill was introduced that would have effectively negated the core components of the raise the age legislation. And it was a bill that was introduced that would have required any youth accused of a violent felony to be charged as an adult. You know, um, you know, and so it would have taken us right back to, in this case, a youth 13 through 18 years old, if they were charged with a violent with a felony, oftentimes, a serious violent crime, it would have led to them automatically being charged as an adult as well. So I say all of this just to note that these types of reforms can be very fragile. And this leads us to really then sort of turn to how is it that within the juvenile justice system that we're trying to think about how it is that we are conceptualizing risk reduction efforts. And as I mentioned before, the risk-needs-responsivity model is the most predominant model in juvenile justice spaces that would help to support violence risk reduction. It's known as the R&R model, and it actually consists of 15 different principles here as well. But the core principles are known as the risk principle, the needs principle, and the responsivity principle. Now, I could spend, and I usually do in other presentations, I could spend, 25 minutes sort of unpacking this. But, the R&R model is pretty easy to understand. But what I can tell you is that it's really hard to implement effectively. The risk principle essentially says we need to prioritize services for the youth that are deemed to be at the highest risk for future delinquent behavior. The converse around this is youth that would be deemed low risk for future delinquent behavior. We should leave them alone. We should divert them out of our system to the greatest extent possible. Once we determine who we need to focus on with the right dosage and intensity of services, that's the risk principle. We need to decide what it is that we're going to target. That's the needs principle. And the needs principle essentially says that we need to target dynamic, changeable delinquency risk factors. And the more that we can match those dynamic risk factors to services designed to alter or change those factors, we will achieve greater delinquency risk reduction. The third principle is the responsivity principle. The responsivity principle essentially tells us how it is that we should engage in our intervention efforts. In other words, we need to focus on building relationships. We need to focus on skill acquisition and skill building. And we need to meet a youth where they are at as well. And so it kind of tells us and reminds us the how it is we should be going about intervening as well. Now, another important component of R&R is that to determine risk, need, and responsivity, there's a reminder is that we should be utilizing what is known in our field as structured risk needs assessments in order to inform the use of the R&R model for appropriate case planning. So, oops, and I will back up here before I jump there. And because I mentioned this already, overarching principles that sort of sit within the R&R model is even if we're focusing on determining level of risk and determining those needs and responsivity factors, this model stresses the power of relationships. It says that engaging service users in relationships that are respectful, caring, enthusiastic, and collaborative while motivating our clients, including adolescents, while also valuing that they have personal agency and autonomy, are an important component to delivering good R&R services. But ultimately, we need to focus on skills. We need to, and what facilitates change in attitudes and behaviors is actually promoting pro-social modeling and effective reinforcing and disapproval, but really focusing on skill building, cognitive restructuring, problem solving, and effective use of engagement and advocacy to support greater skill acquisition and generalization. Now, you might find, particularly when we start talking about relationships and some of those overarching principles of agency and valuing and respect and autonomy, this is going to remind you of SAMHSA's and the CDC's 6 principles for a trauma-informed approach, to service delivery. I think what all of us also would fully recognize is that we know that this is a very dynamic process. It can't be achieved through any one single training, any one single technique. That this requires a lot of constant attention and awareness at an organizational level to really be thinking about how it is that we are incorporating these principles of safety, trustworthiness, transparency, peer support, collaboration, empowerment, into the way that we are working, the way that we're working with youth clients. And one of the challenges that we find in youth justice spaces is thinking about the importance of taking a trauma-informed approach, but that bumping up against, the mandate to also focus on the use of the risk-needs-responsivity model as well. But returning to this, why do we use R&R in juvenile justice settings? And one of the reasons that we use R&R is because it has a strong evidence base. So this is a figure that is a summary of over 300 different tests and analysis of services for both adolescents and adults, and looking at these services and their impact on recidivism, and how often of those 3 core R&R principles were being followed. The risk principle, the need principle, and responsivity. Now, clearly what you can see is that when services are aligned with all 3 of these principles, you get a greater reduction in recidivism. And that reduction in recidivism tends to be more pronounced in community settings versus in out-of-community or residential settings. Okay? Now, part of the R&R model is also determining those needs, often through risk needs assessments. And you may be asking yourself, well, what does the evidence say about what are the most important dynamic or changeable delinquency risk factors that are associated or that predict both, general recidivism, but also violent recidivism? And the table on the left shows the most common dynamic delinquency risk factors that have received the most consistent empirical support. And highlighted in red are factors which consistently show up in the literature as showing the strongest empirical support of their association with future delinquent behavior, both violent and nonviolent, disruptive behavior problems, attitudes condoning violence, delinquent peers, and family parenting and monitoring. And if you'd like to unpack some of these results, some colleagues of mine have just released a few briefs and webinars on what is known as the Youth Protective Factors study. In this study, they tracked over 3,000 adolescents in the community and tracked their recidivism rates for over about a 2-year time period after they'd completed probation supervision. And the four factors that are referenced here or highlighted in red are the factors that predicted both violent and nonviolent recidivism over that two and a half year time period, right? And so what the R&R model tells us is that the more of these factors that you have, that signals the need for the greater intensity and dosage of services. And what are the factors that when they're present, should we focus on? That's the needs principle. It's the four that are really reflected here as well. And the greater that we can match services to those needs, the more likely we are to get a reduction in recidivism. But it's really important to recognize that it's not just about needs, it's also about thinking about strengths and protective factors as well. A really unique thing about the youth protective factors study is that it tracked, as I mentioned before, over 3,000 youth across 3 different states for up to 2 years. But for over about 1,000 of those adolescents, they administered a survey of 9 protective factor measures that really were summed up in these 4 domains: pro-social identity, pro-social engagement, social support, self-control, and self-efficacy. And there's a brief that the researchers have offered if you'd like to download and dig into this a little bit more, but I'll give you the key finding is that across the 3 states, when youth identified and rated themselves as having these protective factors, all 4 of these factors protected against recidivism, even when there was risk present as well, right? So we've got some empirical evidence that youth self-reported protective factors actually can buffer and reduce future recidivism and violent recidivism, even in the presence of some of those risk factors from the previous slide. And the factor that had the strongest evidence for buffering and reducing violence risk is this idea of self-control and self-efficacy. And this was really defined by the authors as how is the youth able to control their emotional and behavioral impulses? Self-control, right? Self-efficacy. How much does youth believe in their own ability to handle life difficulties, right? Now, I want you to hang on to this though, because when we start now thinking about the impact of trauma services, trauma-informed and trauma-specific treatment services, we really want to, I think, start to think critically to what extent our services can help to support the either enhancement or development of any of these 4 protective factors. And I think what we tend to see often is that we're going to see, enhancements in self-control and self-efficacy as being strongly related to the mechanisms of change that we can see in trauma services as well. Just notice that my video was being all weird, so let me see if I can get that to pop back as well. All right, so I would just want to, I know that's running through some of that material pretty quickly, but let me take and offer just sort of like a few sort of key points around the R&R model. When it's implemented well, right, and consistent with all 3 of the R&R principles, like case plans, whether it's community supervision, residential, or reentry, when it's both structured by the good use of a risk needs assessment tool, and you get a case plan that is designed with the R&R principles, it results in reduced recidivism. And the key mechanism here is matching services to prioritize dynamic delinquency risk factors. That's a critical approach. Now, what I would also conclude, though, is that in general, we know a lot about the risk principle, we know a lot about the needs principle, but we know far less around how to effectively address the responsivity principle. And this leads me to kind of like the first lessons learned that I want to pass along. I think in general, it's been my experience in working within the system that adolescents in general are used to being asked about what they did and all the bad things that they might have engaged in, and really not what has happened to them in the context of some of their negative behaviors. What I've also observed is that simple mechanical use of those risk needs assessment tools that are often required in order to do R&R, they overfocus on the risk principle and the needs principle. And that unfortunately perpetuates what I would call a deficits model. And it fails to really signal the depth and complexity of that third principle, which are responsivity factors. And while I've seen in systems a greater use of things like universal trauma screening when a youth comes into contact with the juvenile justice system, even when that is part of system intake, too often results from that trauma screen are siloed away from the risk needs assessment, with system professionals really failing to consider why trauma needs are impacting the youth's past and current functioning. And that leads me now to really start, thinking about a few other critical points. Under the R&R model, mental health problems in general and trauma problems in particular are considered responsivity factors. Um, and it's my thought and my position is that failing to really carefully consider the impact of trauma as a responsivity factor is going to result in a violence reduction or delinquency reduction case plan that's going to fail to achieve the goals of supporting improved functioning and risk reduction. But what I'd also like to support is that our systems don't have to choose a case management or an intervention approach that is just purely R&R or trauma informed. I think both of these approaches can operate in a collaborative and a coordinated manner. And which brings me up to my second lessons learned, right? Um, Oftentimes I've sort of lamented, especially in the past 10 years, um, some failures of our system, failures of our systems. Like, why does it take an adolescent being charged with a serious violent crime? And at least in New York City, spending anywhere between 6 to 8 months in a detention center in order to gain access to a comprehensive trauma assessment. In other words, why are we attending to responsivity factors so late in the process? And while I want to acknowledge the benefit of hindsight, um, it's been my experience that adolescents' lives are filled with tons of missed opportunities to identify and intervene earlier in development as well. I was doing an evaluation for a youth that was charged with a homicide, and in going through that youth's history, um, I could find all the missed opportunities at the family level, at the school level, and even in his first contact with the juvenile justice system where after he'd experienced a number of extreme traumatic events, including the loss of his paternal grandfather, no one asked him, "Hey, have you had any stressful events recently?" And while all this had occurred, this youth was actually deemed to be a first offender, was referred to only an anger management program, and within 6 months, he'd actually engaged in behavior that resulted in the death of another individual. And oftentimes, then I think that this leads to this point that failing to offer effective prevention or early intervention um, just perpetuates and can result in the accumulation of adversities and traumatic event exposures that are going to support a narrative of trauma as not being a responsivity factor, but as actually being an aggravating or a risk factor. And while I've seen that there is a greater emphasis on trauma-informed approaches in juvenile justice spaces, this kind of push for trauma-informed care, unfortunately, it bumps up against the realities of youth violence and high rates of community adversity and violence in the communities that we are often working in. And I think, unfortunately, this can contribute to the risk of what I would kind of refer to as system trauma-informed care fatigue, or the idea of, really, okay, doc, we can get this youth into trauma services, but if they're just going to go back into this community where they're going to continue to be exposed to gang violence, drugs, and crime, what good are we doing? And I think that this can actually contribute to a little bit of what I would call system level hopelessness as well. Now, to be more optimistic, though, I think that there is a way of integrating the R&R model, and information about trauma to inform a more holistic approach to understanding adolescents. And this is going to be a complicated figure, right? But I'm going to do my best to kind of break it down for you. Okay. So under the R&R model, as I briefly explained, we know that the load of dynamic delinquency risk factors is seen to directly influence the youth's future risk for engaging in reoffending behavior. That's the risk principle and the needs principle. The responsivity principle, tells us that factors like mental health and trauma are not direct predictors of delinquent behavior, but when they are present, it may actually aggravate or sustain the presence of dynamic delinquency risk factors. Okay? And so that's just kind of addressing responsivity. And what that model says is offering direct trauma services, while it may help to, reduce, trauma reactivity, it's unlikely to have a direct result on reduction in offending unless it's altering the strength of those dynamic delinquency risk factors. But yet, if we look to decades of trauma research, what we also see is this orange path. The more cumulative traumatic event exposures a youth has, there's a greater likelihood of leading to trauma reactions and associated mental health problems. And we do find that that is, in the trauma literature, is also associated with an increased risk for aggression and delinquent behavior. The challenge from that research is that it tends to not also consider the presence of those other dynamic delinquency risk factors under the R&R model. So in other words, we really need to think about the integration of both. What I would promote is that by carefully thinking about R&R based case planning and taking into account the impact of trauma, we can help to see that dynamic delinquency risk factors and traumatic event exposures often mutually inform one another. Let me give you just a practical example of that. We can think about a youth that I evaluated in the last 6 months. He gets jumped for his coat and beaten up on his way home from school. Okay. Within 24 hours, that youth had joined a local gang. Within 2 weeks, that youth was selling substances on the street corner as well. And within a year, he was a driver in a drive-by gang retaliation shooting that resulted in him being charged with murder. Okay. So where did some of those dynamic delinquency risk factors, negative peer group, substance use, some antisocial attitudes, etc., that all sort of germinated and had its genesis in that initial traumatic event exposure of being jumped on his way home from school? Unfortunately, we can also see the reverse. We can see that youth who may be, quote, in the street more and hanging out with what is known under the R&R as like a negative peer group as well. Unfortunately, that can increase the likelihood that a youth is going to be witness or experience community violence exposure as well. And so we can see that sometimes those dynamic delinquency risk factors can increase the risk for traumatic event exposures. And this will help us to understand that both of these things can then inform the development of active trauma reactions and other associated mental health problems that can then help us to really think about a more integrated way of thinking about reoffending risk. However, I also want to add that what we also know is that youth who are poly-victimized and who develop active trauma reactions that are consistent with complex trauma are likely to show a pattern of functional impairment that we can refer to as chronic survival coping. And chronic survival coping is the day-to-day functional impairments of the accumulations of trauma impacts, but also that those other adversities and negative impacts along the social ecology that are those dynamic delinquency risk factors that can result in a youth that is experiencing an increased risk for reactive aggression, an increased risk for a sense of for a sense of um, for a sense of hopelessness, um, and uh, also that kind of sense uh, of increased poor frustration and tolerance as well. And I think there are multiple pathways for us to be thinking about the survival coping that ultimately can be informed by thinking about the traumatic experiences and trauma reactions that a youth has had, but also how that gets exacerbated by those dynamic delinquency risk factors across the social ecology. So hopefully this shows you a way for us potentially as mental health professionals, but also as, those who may be working in youth justice, to feel like that we can actually integrate and be thinking about both a trauma-informed approach to case planning, but also that risk-needs-responsivity approach to case planning as well. And I think that there's some important practice and policy implications from this approach. Just as a reminder, my perspective here is that a traditional case management approach, even when it's well informed by the R&R model, it's probably going to be insufficient to support delinquency risk reduction, particularly for youth with extensive trauma needs. What we know from the trauma literature and through this articulation of this enhancement that I just mentioned, cumulative traumatic event exposures and dynamic delinquency risk factors operate through mutual influence and impact. And I think this really reinforces from that trauma-informed approach that universal trauma screening and then access to a more comprehensive trauma assessment that could unpack these associations and this unpack the trauma and dynamic delinquency risk factors. This is really needed. And it's hard, but it can be done. And the reason that it's hard, it's because of the heterogeneity in both those dynamic delinquency risk factors and also trauma needs as well. But unfortunately, I think what we know from the trauma literature is that cumulative risks and needs and traumatic events, they set the stage for polyvictimization and complex trauma reactions that are going to contribute to chronic survival coping. And ultimately, though, for those youth that engage in and have a load of dynamic delinquency risk factors and trauma needs, is we can think about that trauma-informed approaches and trauma-specific interventions could provide a path towards delinquency risk reduction. But we need to carefully consider what the mechanisms of change might be that could help to support that. I just want to acknowledge, as we move towards the end of the presentation, though, is that this model needs some enhancement, right? I think we need to, in looking at this integration, we need to think about a greater integration of historic, cross-generational, and race, ethnicity, and identity-based adversities and exposures, and utilize that to inform our screening, assessment, and intervention models. We also need to fully acknowledge and really investigate some gender-specific pathways that likely exist from within this model as well. While I could talk probably ad nauseum about real life examples of what I've seen from youth of chronic survival coping, I think I need to fully acknowledge is that we do not have a good assessment approach right now to be identifying and looking at the impact of chronic survival coping. And ultimately, I think that in a good trauma responsive way, we really need to be thinking about involving youth and families as co-collaborators and investigators as we look at ways to try to unpack and assess chronic survival coping. Then I think we need to think about what are going to be the core competencies and skills that behavioral health and juvenile justice professionals really need in order to do this more holistic, integrated approach in screening, evaluating, and then intervening. And also really thinking about drawing on both trauma-informed care and the R&R organizational principles and capitalizing on the healing power of relationships. And while I fully acknowledge that this model in many ways is going to perpetuate that deficits approach, I really think that we need to approach testing elements of this model through more of a strengths-based lens, particularly thinking about ways in which all of our interventions are thinking about enhancing that protective factor of self-control and self-efficacy. And so I want to acknowledge then, from this perspective, just a couple of other lessons learned in my work with adolescents as well. So while I'm a huge advocate of trauma-informed care and thinking about, a more integrated model of violence risk reduction, what I've often seen in my work is that violence exposure, particularly community violence exposure and trauma loss, even if that loss is ambiguous, they are frequent, common interpersonal traumatic event exposures. They often co-occur in youth that come into contact with the juvenile justice system. And we're looking at some data right now that show and support that this has a great destabilizing effect across multiple domains. And unfortunately, trauma loss is one of the most strongly endorsed traumatic, quote, traumatic event exposures among youth that come into contact with the juvenile justice system. But unfortunately, I think we fail to consider the differential impact of how that loss occurred. For example, witnessing or how that adolescent may have witnessed or experienced the violent death of a loved one, family member, or friend, and may be experiencing some classic PTSD symptoms based upon that experience. We often fail to consider and unpack the difference between those classic PTSD symptoms about how the loss occurred and whether a youth is experiencing complex grief reactions and responses, whether they've experienced bereavement or whether they're experiencing ongoing grief reactions. I'll give you two kind of examples of this. Recently completed an assessment of an evaluation of an adolescent that was charged in a gang retaliation and shooting, where one of his peers was unfortunately shot by one of his friends. And the client told me repeatedly of what it was like to experience, his friend struggling to breathe from being shot and bleeding out on their way to the hospital as well. And he had tons of intrusive reactions and intrusive memories about this experience and increased his hypervigilance and his guilt about being responsible for the death of his friend. Right? That's thinking about the impact of how the loss occurred. Contrast this with the youth that I was just meeting with earlier today, who, in a very poignant way, has a elbow to wrist tattoo of 4 of his friends that he has lost through traumatic means over the past 2 years, with their names and the dates of their birth and death tattooed on his arm. When I asked the youth about this, of course, he can describe how it is that they died through gun violence, but he very eloquently just told me, but no one understands my pain. Not referencing how they died, but the fact that he has lost people that are important to him, right? So I think what this has led is to a need for us to really give equal attention, not only to the traumatic event exposures and trauma reactions from the classic PTSD sense, but to really give credence and start to think about trauma loss and the extent to which an adolescent may be showing symptoms of prolonged grief disorder. And that needs to also inform our screening, assessment, and intervention. And this is why through the CTRJJ that we are enhancing and providing additional training and consultation support on models like trauma grief components therapy for adolescents and multidimensional grief therapy, really attending to the idea of trauma loss as being quite common among youth who come into contact with the juvenile justice system. And we often are confusing grief with active symptoms of PTSD. And I'll conclude with these final lessons learned here. Sort of leaning back to where I started from and the idea of adolescents as being categorically less culpable than adults because of ongoing adolescent brain development and maturation. Well, I think what we also need to recognize is that, yes, adolescent brains are still maturing, but parts of the brain that are most impacted by trauma are the parts of the brain that mature too quickly or that occur more quickly. And so the adolescent brain that has experienced polyvictimization and complex trauma is at an uh, even further ability to sort of regulate themselves and to engage in appropriate impulse control and self-control, emotion regulation. And unfortunately, what I've learned through my work is that chronic survival coping and access to weapons, unfortunately, for many youth that I see, lead to tragic consequences. But I think we need to expand the frame and also recognize that chronic survival coping contributes to not only to just violence and delinquency, but it contributes to a range of other destabilizing outcomes: overdoses, suicide attempts, non-suicidal self-injurious behavior, and a pattern of acquired callousness as well. And so I think that we need to really think critically about expanding our frame and really thinking about how chronic survival coping is, in fact, impacts other adverse outcomes beyond violence and nonviolent delinquent behaviors. And unfortunately, think, and the research really bears this out, that the level of need far surpasses the number of qualified mental health professionals who can deliver trauma-specific treatment services to youth who are trauma impacted and grief impacted in the juvenile justice system. And so through the CTRJJ, this is why we're providing a range of training opportunities like the NCTSN's Think Trauma curriculum and other interventions that are supporting and equipping non-mental health professionals with basic self-regulation skills that then can be coached and reinforced and role modeled for youth and families as well. So I'll leave you with a few takeaways and then some resources, and then see if there are any other questions or comments. The first takeaway is effective use of the R&R model in youth justice spaces can result in more youth being diverted and successfully supported through community-based interventions. Um, and this is by highlighting the role of those empirically supported dynamic delinquency risk factors. Um, I've hopefully been able to show you that we don't have to choose between just that R&R approach or a trauma-informed approach. There's a way to engage in a thorough and thoughtful integration of the strengths of both of these models in a way of really thinking about assessing the impact of trauma that then can help to explain delinquent behavior and ways that we might think about intervening. We need to carefully consider how trauma-informed and trauma-specific treatment services are aligned with this promotive and promoting this protective factor of self-control and self-efficacy. And I would be remiss without also saying is that I really consider that it's a privilege to do this work, but we also need to recognize the toll that it can take as well. And so we need to be aware of and vigilant to the idea of burnout, what my colleague Patricia Carey refers to as empathy fatigue, and secondary traumatic stress as we go about the work of working with youth that have experienced highly traumatizing environments and are engaging in factors that are supporting aggressive and violent behaviors. So I'll leave you with that. And here's the QR code where you can scan into and find a number of the resources that I mentioned through the CTRJJ here as well. And if I'll leave this up as well, it's the same QR code. But if there's any questions or comments that I can try to address in like the 3 minutes that we have left, please shout them out or let me know via chat.
Hey Keith, it's Curtis actually, a student at UC Irvine.
Hey, Curtis, how are you?
I'm doing pretty good, coming up on that dissertation year, so kind of perpetually stressed. But I did want to say that I really appreciated your talk, especially the conversation around survival coping. And I think as someone from a lot of these communities, a lot of these characteristics that you kind of mentioned in survival coping